Well, hello, everybody, and welcome to episode 30 of Cincinnati Cancer Advisors Medical Minute podcast, sponsored by Kroger Health. And I am here today with a friend of mine, John, too. We go back to a prior life together when I worked for a hotel in Italy, and John would host his wellness seminars there. I think anybody that's been around this area for very long knows of John. He's a neurosurgeon with, about 50 years of experience now, probably?
No, it's getting closer to 60.
60, okay, all right, okay. So we're really thrilled to have John here today. And so John will hopefully become part of our new senior medical advisory board that we're looking to start with very prominent kind of currently practicing and or retired doctors, but wanting to really have our patients avail of their knowledge. So hopefully John will join us as our expert in neurosurgery. So stay tuned for that. I'm also here today with Jill Hunt, oncology nurse practitioner, and my colleague as well. Welcome, Jill.
Thank you.
All right. So, Jill, why don't you walk us through some of the very general, very high-level statistics on brain tumors?
All right. So, thankfully, Steve always prepares a wonderful script for us so that we don't miss any of the highlights. But when we're talking about brain tumors, about 700,000 Americans are walking around with a primary brain tumor, and about 90,000 people will be diagnosed with primary brain tumors in America each year. The nice thing is about that, though, is about 70% of those brain tumors are considered benign or non-cancerous. When you're looking at men versus women, who gets more? Women get more brain tumors than men, about a 20% increase. I could plug why women would be more likely to get brain tumors. Might be because of the high function of their brain, but so when you are breaking down the difference between brain tumors, we talked about benign being non-cancerous. Obviously, you also have malignant or cancerous tumors. Women are more likely to get the benign brain tumors, and men are more likely to get the cancerous brain tumors. Little bit more on statistics. African Americans are more likely than white Americans to get brain tumors. However, our African American population tend to get the more benign, and our white Americans tend to get more malignant. Average age of diagnosis is right around 60, and about half of all of our cancerous brain tumors are referred to as glioblastomas, and those tend to have a worse prognosis. So, and then looking at overall survival rate for all, like when you clump them all together, all primary brain tumors actually have a pretty high overall survival of about 75%.
And John, so those you can get different statistics, but I think those are probably within the range based on a couple of things I looked at today. But one of the things too I'd love to have you comment on is when you hear someone say, "Oh, you have a brain tumor," I mean, there's not probably too much you can hear worse than that. But an important point is that so many of them are benign, right?
Well, that's not the first thing that a person thinks about. Yeah. Brain tumor, oh my gosh, that's an emergency. That's something we all know. When you have a brain tumor, you want to see somebody who's an expert quickly. Mm-hmm. But fortunately, as Jill points out, so many of those brain tumors are benign. In fact, there are basically only two types, benign and malignant. And those brain tumors that occur inside the brain and those that come from other parts of the body, called metastatic. And they're actually more common than brain tumors that start inside the brain. Okay. So they're fed into the brain through the bloodstream.
Okay. And that would be like your melanomas and things like that would metastasize?
Lung
breast,
cancer.
Lung and breast and lung and melanoma are probably the three most common that go to the brain, and they go inside the brain rather than, but they can be outside, but they're all immediate concern when they get to the brain.
Okay. And is there anything, because you do look at the things on glioblastomas, or I guess they're called gliomas as a class, right?
Yes.
Okay. Is there anything, obviously with everything we've come a long way, but the statistics are still daunting for that. So is there anything that's on the horizon that people should be hopeful about, even if you do get that kind of dire diagnosis?
Yes, there are lots of things to be hopeful about because many of brain tumors, even some of the more malignant ones, can be cured with surgery and immediate treatment, consisting of radiation and some forms of chemotherapy. But I don't want to lose sight of what each person can do. A combination of what's called 6 different things, of which a lot of things that you might not think about, or even your doctor might not tell you about. They're the behavioral things, like sleep, like taking care of your body, good nutrition, exercise, and wellness. Taking care of yourself is very, very important, particularly when you have any form of cancer, not just brain tumors, but particularly the malignant type of tumor and those that come from other parts of the body. It's extraordinarily important. There are a lot of people who live a long period of time even with malignant brain tumors, and that's the hope, to study those people and to find out what they do and follow up on it.
Yeah.
So when we have patients who are initially diagnosed with a brain tumor, what determines if they are operable versus non-operable?
It's all based on the appearance on imaging, and imaging leads to a biopsy, which tells you exactly what the genetic footprint of that tumor is. And so many times you can tell exactly what the prognosis is. But even given all of that information, there is hope because of surgery is a big factor in many, in fact, almost all of the tumors. So it's important to recognize them early, and the symptoms may be very minimal, like headache, occasionally some alteration of consciousness. We call it a seizure, or you recognize it as epilepsy, but it's not always that. It may be something very simple, like a feeling of numbness or change in the ability to use your hand. Those are probably the 2 most common things, either headache or some alteration of consciousness. If it gets all the way to paralysis or loss of ability to walk, it indicates it's pretty advanced. You don't want to get there.
So, not that anybody likes to think that our tiny human population can be affected by cancer, but the very big reality of it is that pediatric cases, kids can get brain tumors. Although it's a really small percentage, I think what Steve had found was it's only about 6% of all brain tumors are pediatric. However, even though that's a small percentage, it also it's found to be the leading cause of cancer-related death in kids aged 0 to 14. So what are the greatest challenges in treating these pediatric brain tumors?
Well, the good news is that almost an extraordinary amount of progress has been made in that area, and many tumors that were just hopeless when I was starting my career in neurosurgery are now curable by a combination of the things that we talked about. Most of those tumors are associated with either genetic changes or changes in the chromosomal material in the brain. So they appear relatively early. Almost all are under the age of 15. And there are only about 2,400 children per year that in the U.S. that show up with a brain tumor. So they need to be recognized very quickly, almost always headache or occasionally a conversion. They're located in the back of the head. And the prognosis is getting better and better all the time. Many of them can be cured, and others prolonged. So it's very helpful.
Good.
Yeah, that's good. Hey, John, I thought of something when you were talking just a minute ago, and it's just a curiosity question, but if you think about when we're talking about tumors being operable or non-operable, and I would think sometimes that can be how pervasive it is, maybe pressing against other things and things like that. So have robotics or robotic surgery, is that much of an issue here? Has that improved anything? I mean, where the ability to be just a little bit less risky?
I'd break it down into two areas, Steve. One is the diagnosis, but you can discover brain tumors so early now through magnetic imaging and even PET scanning, so that you can see the tumor when it's just in these very early stages. So it's important to report any signs that we talked about, headache or any changes in your consciousness, because it makes such a huge difference.
Okay.
But yes, surgery can be done, and it's almost always done now, either robotically or similarly based on the imaging techniques.
Okay.
You can get to it through very, very small incisions, many times no incision at all. Some of these tumors can be approached through the nose, some through needles, and it's possible to even direct life-saving radiation to a number of the benign tumors, which can cure them without making any incisions or causing any changes in neurologic status at all. Proton beam, for example, which UC and Children's Hospital has one of the most successful ones in the country. So we're very fortunate to have that here in this community.
We mentioned, I think we mentioned that a couple of weeks ago. I can't remember what prompted it, but I kind of said, we've got one in Westchester, and I don't think so many people know that.
And it just focuses right on the tumor. You can use the robotic ability of imaging and using the MRI and the PET scan to focus it so perfectly that it doesn't damage in the brain around the surrounding tissue.
And you just said something interesting, too, that I wanted to follow up on quickly. You said kind of life-saving, and you mentioned that in combination with benign. So is there a possibility that sometimes a benign tumor will evolve or morph into a malignant tumor?
Yes, that's particularly true about the tumors that are called gliomas that are located inside the brain. And it can apply to metastatic tumors also. They can actually spread throughout the brain if they aren't treated early. Of course, the body treatment is important, but in primary brain tumors, it's very important to recognize them early. You do the treatment and stop them from growing, because they can evolve or progress from benign to more aggressive. And that's true of all. Even the benign tumors can sometimes become much more aggressive if they aren't treated effectively early.
And I was going to ask you a question about integrative health, but you already went there.
Well, so that's my primary focus right now, because I think it's so important not only to brain tumors, but particularly to brain tumors, because we know so little in our knowledge of what causes brain tumors. So we really need to work hard on dealing with things that we can control, that are within our control, namely behavior. We're talking about exercise, food, good food, and sociability, social connectivity, and reducing stress. And, of course, putting all those things together.
I don't think our donuts would fall into that category.
Well, I have a little sin every once in a while. Everybody has to do it. You can't do it all at one time.
So if anybody had witnessed me trying to tie a bow tie, you would have thought I have a brain tumor. But thankfully, John and Jill took care of that for me. So I'm wearing my bow tie today for two reasons. One is an homage to Dr. Tu, and then the second is I did promise that when we hit 500 podcast subscribers, I'd wear a bow tie. And Sherry Hughes promptly went out and got like 75 more last week. So here I am.
With your bow tie.
And a handsome bow tie it is.
Thank you very much. You wouldn't have been handsome if I'd have tied it, I can tell you that much. But anyway, so thanks so much, John, for coming today. Really, really appreciate it. Thanks to all our subscribers. If you're not a subscriber now, please join. It's really important that we continue to develop a relationship with our viewers. We want this to be as helpful as we can make it nationally, even beyond. And we'll do that by bringing in thought leaders like John. So I really appreciate you being here today, John.
Steve, let me say a word about how important I think what you all are doing is for the community at large, and how honored I am to be a small part
We appreciate it.
Thank you.
Thank
We
you.
appreciate it. All right, everybody, tune in next week. We'll have our new director of precision oncology, Andy Guinagundo, on, and we're going to
Good
talk.
job.
I know, I nailed that one. So we're going to talk about kind of our new focus on precision oncology here as well, and trying to improve outcomes through that as well. So, thanks everybody. We'll see you next Wednesday at noon. Take care.
Great.